Alrighty, good morning, good afternoon, or good evening, wherever you are in the world. I'm Ali Nasseh, and it's a great pleasure to be here with you for the next half hour to an hour. And we're going to we have a little bit of a free-flowing conversation about the new COVID-19 and the coronavirus and its impact on dental offices. Coming to you here from Boston, Massachusetts, and obviously we're having a little bit of a different type of an experience than some parts of the world. Everything is fluid at the present time, and we're just going to kind of chat to you guys, get some of your opinions about your views of how this is impacting your dental office in terms of whether it's the supply chain, the fears of the virus spreading, and your own safety, and that of your loved ones. Clearly, those are all very important factors. So this is fairly informal. I decided to do this live session. Actually, it's our first live session here on YouTube, and I wanted to put a number of little information together and a couple of slides here that I'm going to go through quickly on this virus and the disease process, and then we'll come back, and hopefully if we can have a chance, we'll have a little guest a little later on as well to talk about this virus and how things are going to go through. So without further ado, first and foremost, I want to say how happy and glad I am to have you guys here on board. It looks like we have about 90 or so people right now watching this live, and we're going to kind of get started here and talk about the COVID virus right away, and then we'll go from there and ask some questions and answers and see how everybody is doing with their own offices. So COVID-19, again, keep in mind that this is all separate. I'm coming to you from Boston, Massachusetts, and my concerns and the information I'm going to relate are going to be local to the United States. If you are living in some of the other places where the risk of transmission is higher or lower, you're going to need to obviously consult your own local places. So having said that, let's kind of get this started and quickly talk about this. Just a quick bit of terminology ahead of time here. Just back in December, not too long ago, if you think about it, there was an outbreak of pneumonia in Wuhan, China, right around December time, and people were all of a sudden falling ill to different degrees, and this was something that was noticed. There was an outbreak, a local outbreak that was probably coming from seafood wet markets in the area, because coronaviruses are a class of viruses that are essentially these are viruses that are RNA viruses. There's a single strand of RNA, and they come from the Coronaviridae and the order of Nidovirales group of viruses. And there are generally 4 different subtypes of these things: the alpha coronaviruses, the beta coronaviruses, the delta and the gamma coronaviruses. In total, I think we have so far isolated and found 7 coronaviruses that affect human beings. The most recent ones that you guys have probably all heard about, besides COVID-19, is the SARS and the MERS coronaviruses. These are special kind of viruses with the single strand of RNA in the middle, and the reality, and they have a capsule that's kind of a lipid-based, and part of the reason why they are so susceptible to detergents. So the main point to learn from these types of viruses is that their envelope and the capsule that they carry is susceptible to detergents, so therefore washing your hands routinely is going to be greatly helpful in terms of getting rid of the virus, which we're going to talk about some of that stuff a little bit later on as well. This virus was probably first noticed by Dr. Lee, who was a local physician down in Wuhan, and unfortunately he fell sick to it as well and passed away. You know, the key with the pandemic, with these epidemics, is to be contained. Unfortunately, this wasn't contained early on enough, and now what we have is a pandemic on our hands. And a pandemic, by definition, is a situation in which there is sustained community-acquired transmission. And community-acquired transmission essentially is talking about a type of transmission in which the cause is unknown. It's not somebody directly, sneezing or coughing into your face, but the people that have acquired the disease are unable to tell where it came from. So obviously, all of those comes essentially from contact with droplets and the virus particles that are coming from the infected individuals. But once you have a pandemic on your hand, which means the virus is no longer able to be contained, then you're starting to talk about mitigation of the risk, which means how can we really reduce the risk? And we'll talk a little bit about that as well. Just quickly to go over some of the common symptoms with the coronavirus compared to the cold and the flu. Clearly, the main parts of the coronavirus disease are having a fever, feeling the malaise and the fatigue, and having a dry cough. There is a variety of ways this can manifest itself in different people. Certainly, different types of different age groups, people have a different exhibition and manifestation of the disease, and clearly this has been shown to be doing far worse in older population over 50 years of age. And the main risk there is that of interstitial pneumonia and that of dyspnea, which is shortness of breath and things like that. Because these types of coronaviruses, which include really the common cold virus, are all causing upper respiratory tract infections. And clearly the method, the kind of infection that you get is going to be related to the ACE2 receptor on the respiratory tract cells that kind of get that the virus envelope kind of attaches to, and that's how it inserts its code. And as we know with most of the viral infections, this is going to cause the death of the cell and so on and so forth. By the way, this is supposed to be a video or kind of a type of a program for dentists that are in practice. This is really not designed for the typical for the patients and so on, but I'm sure there's going to be some who are watching it, so I'm going to try to keep the terminology at a level that everybody can kind of relate to. But with the cold season and the flu season kind of having been around the corner as well, there could be a lot of confusion between what is causing what, and especially with the allergy season coming up, especially with the seasonal allergies in the springtime. Anybody who's sneezing is going to end up having a problem kind of getting their case across that it is actually just allergies. It's probably going to end up being myself because I have seasonal allergies, so the sneezing is going to start. But part of the problem with this disease is the reality is that the mortality rate, although not really high, not as high as many of the other outbreaks and diseases that we've had, is disproportionate in different parts of the population. And as we know, the younger population is not as affected by it, but the rate of mortality has been different by different estimates ranging on total aggregate at around 3.4%. That's been the consensus as of the most recent data that I've gathered. Most of the data that I've gathered here for you since last night has been through the CDC, World Health Organization, and different credible kind of groups. What's also important to keep in mind that the seasonal flu also has clearly the influenza A and B virus have a mortality rate, although the coronavirus seems to have a much higher rate due to what it can do to the as cause of pneumonia in the older population. Just important to also have a little context as to how this relates to these various pandemics in history. Spanish flu of 2018 was a massive kind of an outbreak and pandemic causing over 50 million deaths worldwide, which is clearly as high as that of World War II itself. In fact, if you look at the Asian flu that came in 1957 with 1 million worldwide, and then the Hong Kong flu of the 1968 with another 1 million worldwide, and the most recent coronavirus, not an influenza virus, SARS in 2002 with a 772 deaths, it's pretty clear that the overall cause of death by these pandemics has been even higher than that caused by wars, in human wars and so on. But with this particular coronavirus pandemic, the latest data that I'm showing to you right now, which is actually the latest as about an hour ago, is still showing right now in a population. It's important to keep things in context because we have the Earth population is 7.5 billion people, and then we have 162 72,000 cases of this disease so far, and 6,000 deaths. And of course, we have 76,000 who have recovered fully. So the odds are if you catch it, you're just going to have mild disease. And it's only those people that are very susceptible and are immune compromised are the ones who are going to the primary targets of the worst outcomes in these types of in this type of disease. Now, the problem is that this is now spread to about 156 territories, so it is essentially a pandemic of sorts, and it is spreading. It's spreading at different rates in different countries based on the way they are managing the situation. And that's an important thing. Of course, what we now know from the CDC data and the World Health Organization recommendations is to kind of lay low and kind of chill, fill out and watch all your Netflix movies that you wanted to watch and they're on your queue and you haven't had a chance to watch. So this is a time to kind of lay low. Of course, at the same time, you also realize that the impact of this on business and businesses and the reality that, there's only so long you can lay low. And if we do have a pandemic, in which case the cat is out of the bag, and if as they say, how long can you literally stay home, and at what point does it become one of basically accepting the outcome and people moving out? Of course, this is a very fluid situation. It all has to do with how we can contain it even at this point in different countries. So still the recommendation is to stay low and prevent person-to-person spread, which is not quite as easy because many people who are panicking and they're kind of shoving themselves in a tiny garage or bathroom and to protect themselves have to realize that you really have to be within 6 feet of actually infected individuals. Although respiratory droplets that are produced by the infected person, such as that which occurs during coughing and sneezing, can persist, according to some estimates, by several hours, just basic hand hygiene and regular hygiene and just basic principles would be very is adequate for the most part to address the transmission of the disease. So the real question that comes down here for us as dentists is, can someone spread the virus without being sick? That really is the crux of the issue. And unfortunately, right now, at this point in time, which is the Sunday morning, at 11, 12 a.m., this mode of transmission from asymptomatic patient has been sporadic. There have been some cases that people have talked about where this has happened. But for the most part, what we know for sure is that the most susceptible patients that can transmit the disease are those who are actively infected and are coughing and sneezing and basically just spreading those droplets. So those are the most contagious patients, those that are symptomatic, and the sickest people, because they obviously create the most amount of aerosol. So again, as I mentioned, some spread could be possible without patients being symptomatic, but this is really not thought to be the case. It's not the main way, at least, that the virus is spreading, and this is an important information to have in mind. So again, how the virus will spread from person to person also varies. This is not considered a highly contagious virus such as measles. At the present time, I think the consensus is that it's a moderately contagious type of a virus. It's not very mild or non-contagious, but it is moderate, but not quite as bad as many other diseases such as measles and so on. But community spread here is the main thing, and that's the thing that we can do our best to try to avoid, which means essentially trying to avoid touching our face, nose, and different mucosal membranes in the upper respiratory tract. So I was speaking to a friend of mine who's an ophthalmologist, Dr. Negabon, was talking about the fact that the tears themselves through the nasolacrimal duct could end up being a source of infection. So touching your eyes and getting the bacteria, the microbial fragments and the virus into your eyes, into your nose, and to the mouth are the main ways of transfer. So washing your hands, basic hygiene are really important factors here. And it's important to keep track of this reality, however, in my opinion, what we have now in our hands is two separate things. You have the coronavirus disease, and then you have the coronavirus hysteria disease, which appears to be quite as deadly because from what I'm gathering here, you can have protective gear on the left side here for the COVID-19. Many people are taking it to the next level and becoming increasingly morbid and fearful of this disease, and that's really not necessary. Again, as I mentioned, the main point here is that you have to be careful with people that have active infection. This overexpression of fear has caused lots of shortages, in fact, of masks and supplies for dental offices, and that is something that is really counterproductive because people that are at the most risk are the healthcare providers, and people that are generally not sick, having a mask will not help them. A mask would be very helpful for anyone who is sick by containing the virus. Obviously, basic coughing etiquette of coughing into your sleeve rather than into your hand is also very important. Of course, many memes and jokes have come out of this. This is a guy who's getting a ticket and is trying to talk himself out of a ticket by saying that he has the coronavirus.
I didn't get that. Could you try again?
All right, we got Siri responding to my commands over here unnecessarily. But anyway, so the main point here that we have to keep in mind that during an epidemic, what we have is we have an increase in the number of people that have been infected. And our goal here is to try to flatten this curve by trying to reduce the transmission of the disease, because ultimately what ends up happening is that what ends up happening is that you are going to have an overwhelming type of response at the different hospitals and so on. And what ends up happening is you can't have the healthcare practitioners being able to kind of supply and address the problems of the patients. Okay, so that's that. So what do we do here as our main goal is to flatten the curve, as I have mentioned in this kind of, as you can see here in this graph. And you can also check out this website called flatthecurve.com. And what it does, flattenthecurve.com, and what it does is basically give you some nice protocols and help in terms of addressing this issue. So the most important thing that you can do for your patients in your office is to make sure you contact your patients, send an email, or patients that you are calling or you are having in your appointment book, to make sure that you let them know by having your front desk call and contact them and say that your office is prepared for this and are doing your best of keeping the surfaces clean and applying universal precautions for this disease, and you're going to be able to at least reassure those patients. Also, one of the things that we're doing here is to make sure that any patient that is coughing or sneezing is canceled for the appointment, because remember what you're doing, one of the modes of transmission of this disease is also through the saliva. And while we talked about the fact that we don't have enough information about those patients that are not symptomatic, the reality is that dentistry is working with saliva, so you are in there and you're going to be potentially exposed to this. Although I'm not familiar, nor have I been able to find any specific cases of a transmission to a dentist or vice versa right now of the COVID-19 disease. The fact that we are close to the saliva is a cause for concern, and we need to be aware of that. So make sure that you have a contingency plan for your office in case you or any of your assistants get sick. What is the plan? How do you guys plan on making sure that the flow of the office is continuous and you're seeing patients, and at the same time that if anybody is sick, that you can basically mitigate that risk in terms of closure or containment or kind of a quarantine. Those are the main things that you need to do and have a plan. So get together with your office manager or your lead hygienist on a daily basis and kind of review this protocol and move on. So basically what you would do in a case where an office staff would get sick, and what if you require extended closing of the office. So that's really the graph that I was talking about. The goal here is to reduce, the reason I was stuttering a little bit earlier on is because this little graphic video wasn't working. I couldn't figure out why it wasn't working, but that's really the idea that I was trying to say, is that what we're trying to do is we're trying to reduce that curve below the limit that each country's healthcare systems are capable of dealing with patients that are going to require the ventilators and the hospital care. As we know, the vast majority of this disease is just mild. 80% of the cases are completely mild, and they come in just like the regular cold and they go away. It's only in that 20% that are going to require additional care, and supposedly based on the newest data, about 13 to 14% may require hospitalization. Those are the cases that you want to make sure the numbers are low enough in the aggregate that your local healthcare system can address, the physicians can deal with that. Now, when it comes to the coronavirus's impact on the dental offices, I was trying to be very vigilant and look into and see what are some of really the best practices that you can do. What I'm going to leave you is with this American Dental Association specific site that has been created for any of the recommendations that pertain to dentists, and that is the address below, as you can see, bit.ly/2VQ6BHU, or you can just go to the ada.org, and there's a link from there to which you can go ahead and get the updated information. Unfortunately, so far, there hasn't been a lot of clear information from the ADA. Soon enough, there will be probably more information. Again, as of the date of this little video, there hasn't been any information to tell us what we should do in case of, in case this thing really gets out of hand here in the US. Now, I'd be curious to hear from those of you who are currently online. It seems like we have 163 people watching this now. First of all, what country are you watching this from? And what are some of the specific recommendations for your country when it comes to dentistry? I know several places, they have dental offices have closed down as well. But as I mentioned, if this virus does not kind of slow down on its own, and if it is currently a pandemic and the cat is out of the bag, and if it does take, based on the estimates, something to the order of 18 months or so, a year to 18 months, to develop a vaccine for it, what does this mean in terms of how long can you keep practices closed based on both the public's health as well as the as well as your own staff and your own just overhead and things like that. So what I can do essentially is just share with you some of the policies that we are doing currently in the US based on the level of risk that we are seeing, at least here in Massachusetts and in Boston, at the present time. Again, things are fluid and things can change with time based on how things are going to manifest themselves. But currently, for my office, Microsurgical Endo, here in downtown Boston, what we're doing is we're making sure that all patients are getting a pre-appointment phone call with questions that are specific and targeted. First and foremost, we reassure them about what we're doing in terms of keeping the office safe and clean by doing even beyond the universal precautions, which is something that was developed early on. And just to take a little digression here, I was in school at the time of the major HIV crisis, and that was the same situation where people didn't really know what to do, and everybody was afraid in terms of transmission and so on. And those were really the main impetus. That particular pandemic was the main reason why universal precautions were developed. Universal precautions of using masks, shields, and gloves, and waterproof gowns, and then also cleaning all the surfaces and mitigating and making sure that cross-contamination and contamination are all addressed, were designed so that we treat every patient like they have. At that time, it was like every patient that has a blood-borne illness. Now, they should be updated essentially to have every patient would have to have some type of a droplet-based type of an infection, which means making sure that you have proper face shields and face masks, because as I mentioned, you can get this through the eye, splatter, and aerosol that is created during dental procedures through the eye and through breathing it. There are some studies out there that show that the higher grade face masks are not any more effective than the regular face mask. The key with the face mask is to have a proper seal and have to understand that face masks have a certain type of a lifespan before they get saturated with your own fluids and your own kind of water vapor coming out of your lungs, and then you end up blocking the pores and you end up breathing through the sides. And that's a key thing to make sure that you use fresh face masks. Of course, part of the problem right now is a shortage of face masks because many people that are not sick have freaked out and are using face masks unnecessarily. Remember, only if you're sick you need face masks, not otherwise. People that are in direct care of patients, such as dentists and physicians, are the ones who really, and nurses obviously, and the staff are the ones who should be, who are in most need of the masks. So going back again to what I was talking about here, pre-appointment, the phone call at the level of the office reassures the patients, and then we tell the patients that if they have a fever, any coughing or sneezing, malaise or so on, they can reschedule their appointment for 2 weeks. And if that is the case, if patients are completely healthy, they haven't had a risk of exposure or are under quarantine or anything like that, then as soon as they arrive to the office at the front desk, every patient usually gets a brush and floss from us either way, but we give it to them in advance and direct them to the restroom where they should brush and floss, and then we're telling them to wash their face first and then wash their hands for 1 full minute to make sure that everything is clean in that sense. Some people are also asking patients to rinse with chlorhexidine, although that's probably not as helpful. Alcohol is more helpful for this particular disease, so probably the joke is you can have your patients take a couple of shots of tequila before coming in, then once they come in, obviously, then we would measure their vitals. That includes the temperature. If somebody has a temperature at that time, clearly the appointment is terminated, and they would have to kind of go back and return once the temperature is resolved or 2 weeks later. So once again, the goal here is to make sure that transmission is reduced and we're not having any of these things kind of mitigate the risk and not have anyone transmit and pass on the virus. So that is essentially the basic thing that I had for you. Let me take a quick look at some of the questions here and the things that you guys have written down. And then what we're going to do is probably going to go into our and give a call to our guest here. All right, let's see what we have. With people from Ukraine, Romania, Philippines, wow, that's awesome. From Holland, Germany, Canada, of course, US, and Russia. Look at that, it's awesome. People from the US. All right, so in some of the places international, people are closing offices until further notice. And that probably is a responsible thing to do if you're in a hot zone. Again, what we want to do is we want to make sure that we are not conflating the risk and creating a panic that's above and beyond. Currently, if this is no level of panic, currently people are at this level of panic because of the fact that they're just overstocking in things and buying things. This is in the US. If you are in Italy, in Iran, and in Wuhan province, and in parts of South Korea and different parts of Europe where this is escalating quickly, that may be a different story. But here for us in the US, the panic level is at this level. What we should do is we should just bring it down to this level so people don't end up having to suffer from from anxiety and depression as a result of self-isolation, just as much as they would from this virus and this disease process. So basic hand hygiene is important. What I wanted to kind of do for you also is just to show you that you don't need, not as patients, you don't really need to have gloves and, rob all the healthcare people from gloves and masks. Some simple solutions, frankly, instead of using gloves, what we have been doing forever in dentistry, instead of using gloves and things like that, which what we're using in dentistry, in dental offices and in most medical practices, when you go to the sterilization area, there is a clean side and an unclean side. What would be good if you go out, if you're worried about the risk of transmission through droplets by doorknobs and different places where you're making it when you're touching, you can just kind of take some easy and basic steps, such as one of the little things that I had in mind is this little thing here, finger cots. Instead of wearing gloves as you're walking around, what you could do is you just get yourself some finger cots, very simple solution that you would put on in what I've kind of figured out, just really 3 fingers on one hand, right? And that becomes the dirty hand. So this is the hand. You are not going to catch a disease by just being close to a virus that is sitting on some kind of a surface that was touched by someone who had the disease. But with one dirty hand, let's say your right hand, and then your left hand being the clean hand, you can handle with your left hand all of the items that you're going to have in your personal possession, including your cell phone and things like that. And with the right hand, you can touch the objects that when you go out. What's nice about having these 3 finger cots on is that it also prevents you by accident, because it becomes almost like a reminder by having a little, how people used to make a little knot. It becomes a reminder that you are not going to touch your face, because clearly touching your mouth, your face, and your eyes, rubbing it are the main reasons what you're going to get the transmission from the droplets and that have been on the ground on your finger down into your mouth. And what's nice about these is that you can just then afterwards, when you come home, you still wash them with these on, and then you can remove this, you can roll it back, and then now it's back to its original form, and you can use these multiple times. Remember, you're not going to catch a disease through the skin, it's just going to be through the touching it on your skin and then putting it in your mouth. So basic habits of, as soon as you come home, you wash your hands are going to be very helpful as well. The other key point here is that as the virus, just like the regular cold virus, as it is going to get into your upper respiratory tract, it's going to give you essentially first, you're going to get the fever and a little bit of dry cough. It's going to stay as a sore throat, perhaps for a few days. And then in most people, that'll just going to be a very high upper respiratory tract infection and it's going to get resolved. In some people, it could work its way down into the lung if you essentially swallow and aspirate some of those droplets that are being shed. That's what can happen. There is conflicting stories about whether during this time of the sore throat, whether frequent rinsing with warm salt water could be helpful in trying to address those droplets that are going to form into your tongue or not, but that is not clear at the present time. So with that, let us do a quick little call in, and I wanted to call in Dr. Jennifer Gibbs, who is the postdoctoral program director at Harvard program, and just going to get her view and feedback on this as well. So let's get her on here too. Okay, I am here with Dr. Jennifer Gibbs. Dr. Gibbs, thank you so much for joining me.
My pleasure. Thank you for having me.
Absolutely. So, Dr. Gibbs, as the program director at Harvard Postdoc Endodontic Program, I wanted to get some of your opinions about the COVID-19 and some of the questions that are coming up vis-a-vis the impact on the dental offices and so on. First and foremost, I want to see how are we at the school handling the program, handling this epidemic or just rather pandemic, and how's the postdoc program and the school as a whole kind of mitigating the risk?
Yeah, so it's been a really interesting week last week, and I think we all keep having to recalibrate what we're thinking about this, and it's going so fast, and it's been a lot to kind of keep shifting your mental outlook from what was normal to what the new normal and the new normal and the new normal is. It's been really, it feels like the longest week of my life. But Harvard's been really, really proactive on shutting down. I think us as a school, we have a different issue than a private office in many ways because of just the huge number of people coming in the building every day. So just, bit by bit, that's been shut down. So from going to totally online classes is the first thing. which was an obvious solution to getting a lot of people in the same place. And then we were talking about ramping down the clinic, like that type of model, and having some students in there that still need to do requirements to graduate. But that's shut down to now just having a small urgent care clinic. And so it's really only patients with pain, swelling, or bleeding that should be coming into the office for this urgent care clinic. So we're having a couple faculty, a couple residents there for that. And everything's really shut down. So for a while, it was going to be the research labs were kind of like different and they could keep going. But now, even in the whole Harvard Medical School, all the research labs are closed except for those labs working on COVID-19. So it's really remarkable.
Yeah, it sure is. And we don't have yet any word as to when it is going to open or not, correct? I mean,
That's right.
it's basically as seeing the situation, how it evolves. If the rate of spread is kind of plateauing or hopefully going down soon, versus if it continues to be logarithmically increasing, right?
That's right. That's right. So I think now, you see all the businesses really becoming more proactive about this too. And I was watching you earlier talking about flattening the curve, really trying to be proactive versus reactive on this and really preventing the spread in the community. And then it becomes more of a watch and wait, and how successful have we been with that, and how are these numbers changing? But so far, Harvard has the numbers are different. So there's 2 weeks is what we've said for the clinic so far. I think reality, it's going to be longer than that. And then in terms of shutting down the research labs, they said be prepared for 6 to 8 weeks. So those numbers aren't in agreement completely yet. And I think it's just going to keep evolving.
Yeah, I think at this point, the question and the hope is that this would be a seasonal type of a virus, because if the pandemic continues or even if it plateaus, the idea of shutting down is only possible or practical for a certain amount of time.
Right.
There's going to be a moment of reckoning, I would assume, at some point where people are going to have to understand which direction are we going to go. Are we just going to absorb it and then as a community? Because my understanding is that containment is no longer possible because of its widespread pandemic that we're dealing with. So the question really is, how can we manage the situation until a virus comes around? As they say, estimates are 18 months, some say even a couple of years, based on the testing and the safety required before it could become mass produced. And clearly, I don't see too many people are thinking about just closing and shutting down everything for until then.
Right. Yeah, and that's the part we don't know. So maybe it's
Yeah.
but I think the goal of shutting down as much as possible right now is to kind of prevent that initial surge. And then I don't know how you decide when it's okay to start opening things back up. But that's just going to come. We can always look to these other countries that are a few weeks or months ahead of us and see how they're handling things. Like Korea's done a really good job of getting things under control, and China actually has done an amazing job. And what do they do now that things are tapering off, and how do they open things back up? So we will have the ability to kind of see what happens with them and use that to forecast what we should do.
Right.
One other thought I had about your, deciding about treating patients or not, and if you're thinking of going to emergencies only, I think another thing that's really important is to think of your patient's own risk factors for being more affected by the virus. So this week when I had my own patients in the scheduled, before we closed down, I was looking at those patients and saying, okay, what's their medical history? How old are they? And I would give them a call and kind of say, you're 82 years old. Maybe you shouldn't be out and about and going to a dental appointment right now. Not that it's necessarily dangerous for them during the appointment, but are they going to ride the train there? Who are they going to be sitting next to in the waiting area? Like those kind of questions. And I found that there was quite a spread of how aware my patients were of their own risk factors. And I think every day it's becoming more and more urgent, more and more obvious and in our face. But it still might be worth kind of doing that health service for your patients to let them know about their own risk factors. And we know it's age, cardiovascular risk factors, diabetes, immunocompromised patients that really need to be really careful right now and probably shouldn't be going out.
But at the other side of the kind of a coin, Dr. Gibbs, wouldn't you think that patients that may have urgent needs for some of the dental services, this would probably be where the numbers are still low, would have the
Yeah.
lesser risk? Because if we're going to basically tell people that if they're old, they can't seek care for up to 2 years until there's a vaccine, then what
Yeah.
does that mean in terms of the, of any acute problem that they may have? Shouldn't
Well,
there
hopefully
be?
not 2 years. I mean, again, we don't know.
We don't
Some,
know,
yeah,
right?
some of the projections go on and on, but I've also heard June,
Yeah,
and I've also heard September. So I think we really don't know.
that's true. That's true.
Yeah.
Yeah, we don't know, but you're right. I think still, if somebody has urgent problems, they should seek
Yeah.
care now, because otherwise, that's maybe 6 months down the line,
Yes.
it would be a much worse situation, and that would require far greater, especially for us in the endodontic field, right? I mean, if you
Of
just
course.
ignore a toothache that is severe, you may end up having a Ludwig's angina, and now you're having require hospitalization in itself.
Yeah.
You know?
So yeah, urgent is key. So,
Yeah,
and it's a question I've asked myself like 50 times this last week. What is urgent? We talked about it in our case presentation too.
yeah,
And it's really, you have to consider case by case. And there are some cases that don't have active pain and swelling, but might still be urgent. Um, and we
yeah.
talked about like a kid with trauma and that the endo hadn't been started yet, and really stabilizing that tooth for that patient. So it's not a clear black and white answer for a lot of them.
Yeah.
But a true dental emergency is not a trivial thing. And just, even if someone did have risk factors for having higher mortality if they got the COVID-19 virus, if they're having a dangerous swelling, they still need to get treated, I would think.
No, of
You're
course.
right. The risk versus benefit is pushes much more to the benefit of getting the dental treatment.
Yeah, and what is interesting is that what I'm saying is it seems like that the emergency care part, it should be done sooner rather than later, because I think the epidemic is probably going to grow. The pandemic is going to grow more down the line. And then the
Right.
risk, as you said, especially for an elderly person to make it to the dentist for an emergency care later, would be even greater than it is if they can nip it in the bud
Yeah.
on the sooner side. What do you think are going to be some of the long-term effects or kind of realizations for us in this field as dentists, in this area of both clinical care, on the academic care for the and for the students, and then education as a whole?
So long-term effects of this whole situation.
Hmm.
I think it's definitely putting into focus again what's urgent or not in dental care, and what's elective and what's not elective. I mean, we think of some surgical procedures as kind of being um, like something that wouldn't be a core treatment. But we had a few cases coming up this next week where it's like, if we don't do this surgery, we're leaving this patient with infection that can't be managed any other way. So, that treatment is an urgent treatment. But putting an implant in for a patient is not an urgent treatment, and that doesn't need to happen right now.
Right.
So it's really putting into focus, controlling disease as being an essential part of care. And then if you start thinking about putting that in focus a little more clearly, then shouldn't some of those things be paid for or be covered in a more extensive way, either by public funding or some other way? So it kind of brings those bigger questions into more clear focus. And then education, we're definitely all going to learn how to talk to each other online a lot more right now.
Yeah.
Which,
Welcome to my world.
I need to talk to you.
That's right.
Get some tips. You have a really nice setup, with a lot of experience. So
Right.
and I was it's sort of a revelation, but I was thinking about our seminars and stuff online, and I was like, okay, I got to teach this seminar Thursday at 8:30, and then I'm like, well, it doesn't have to be Thursday at 8:30. And actually, I could ask these other faculty who live in Vermont that they could just jump into the seminar too, and we can do a lot more that way. So it's actually shifting my thinking about so many things in a good way.
It is. I think, I mean, we had the treatment planning seminar on Thursday, and I think that went very well.
Yeah.
We do that in person every week, and we get together in a small room, spend like 4 hours together, and
Yeah.
go over the cases. And I feel like we managed to do it almost as effectively this time, being remote, each in their own places. So
Right.
it's interesting. I can see, in fact, I was telling someone recently, is that, I've been saying this for a long time, that when I realized the kind of the online capacity and potential, and back many years ago, I realized that in the future, the concept of cities as a whole might be obsolete, because the reason we've developed cities with such concentrated population has been in order to address the commerce and trade deals. And with the satellite TV and satellite internet and Amazon and UPS, I feel like the person now living anywhere in the world is just as connected as anyone in New York City downtown.
Right.
So that might help mitigate maybe even some of the real estate prices in some of the denser places. That could be one silver lining in the in this.
Yeah.
But if anybody has any questions, by the way, for Dr. Gibbs, please make sure you write them down. A couple people were asking for, I don't know if they're in the U.S. or not. Again, I'm sure Dr. Gibbs, you agree that depending on the location you are, people should touch base and ask their local dental societies what are the proper protocol. But are cleanings and some of those things, you think?
I think, and I think the response has been pretty slow from organizations. At least I have seen very little. It's been a few days, I guess, since I looked, but it seems like it's the organizations like ADA or AAE for us. They just canceled the AAE conference a few days ago,
Yeah.
and a couple weeks ago we could have thought, oh yeah, sure, that could still happen, but now it seems it didn't take long to make it really clear that conferences should not be happening right now. But then, it's just kind of a delay for these large organizations to kind of shift, to turn, like a big ship to turn. So I think we have to be proactive again and not wait for guidance. We're health care providers. We need to be aware a lot of what's happening with the virus and what are the routes of transmission, who's at risk, because we're kind of going to need to be really informed for our patients for that.
Yeah, that is true. There might be, is here somebody was saying that
And I would say cleanings, especially if you're using an ultrasonic, could be really bad idea right now.
So you think so, creating aerosol. Now, speaking of
Yeah.
that, for during the treatment in endo, I think endo would have an advantage over many of the other fields because of our, insistence on the use of the rubber dam. Would you like to comment about that?
Totally. Rubber dam is a great thing for any dental work you're doing right now. I think it's supposed to reduce the amount of aerosols by 70%. So definitely using a rubber dam is very, very helpful.
Yeah, I mean, but my joke usually with the patients is when they have a rubber dam on, and occasionally accidentally somebody in the past, not anymore,
Yeah.
have a fit, wanted to cough or something like that, they would
Yeah.
automatically bring up their hand to their mouth. The joke was like, mouth's already covered, with
Yeah.
the rubber dam, so that does help reduce the aerosol spray. But if you do have
Your
a
ideas are really great of getting your patient to wash their hands and everything before coming
before
in.
coming in,
I think that's great.
yeah,
I was thinking we should start doing hair cover like caps for every patient for ourselves.
That is true, because you could certainly end up with the with the aerosol and the virus, and if it is true that the virus can potentially survive for a few hours at least before it disintegrates. I guess it depends as to what's the status of the virus. If it is a sole dry piece of virus that falls on you, or if it's in a big piece of mucus where it can still survive. That's probably one of the main things, because there's uncertainty how long it'll survive, because it depends what is the medium in which it is kind of bathing in. People are saying maybe one way to avoid this stuff would be the old school medicine, going door to door. That maybe we can have a dental office set up that way as well, so we don't end up acting as an incubator.
Yeah.
But so yeah, I mean, obviously somebody's saying the rubber dam reduces but doesn't block 100% the transmission.
Definitely.
Obviously, that's true, because again, I think even with the N95 kind of masks, or any mask, and there have been studies, in I think it was New England Journal of Medicine, one was showing that between the transmission, in fact, an outcome study of transmission comparison with the N95 mask compared to the regular well-sealed mask, there was no significant difference. But obviously, there's still the recommendations of the N95 mask. But the more important part, I think, is the seal around it. Because as long as you don't have a seal, then you are still breathing unfiltered type of
and
air.
you have to be fitted for those, actually. And I would think, do people have those in their dental office? Like, we've never had those in our clinics.
No, we haven't had. I haven't had them either, frankly. But they are available for those people who want to use them. So, any what are you doing yourself on a personal basis with the home and the family? Any specific precautions you're taking?
We went on a hike yesterday.
Yeah.
So that was pretty nice, except it was packed, of course.
Really? That's funny.
Yeah, everyone had the same idea. Couldn't even find parking. But it was still nice to just be outside. There was a little bit of sunshine and stuff. So probably go for a bike ride later today. I'm Googling online education stuff for my daughter, since school's going to be, they've only, again, kind of the same time frame of our school. They've closed for 2 weeks, but most likely it's going to be a lot longer than that. So trying to find some things to keep her occupied during the day.
Right.
And I don't know, we're taking it day by day.
It's it certainly is it is a concerning time, but it's very important for people not to panic and start to kind of isolate themselves too severely and end up getting depressed and all kinds of things, especially for the elderly people who are concerned.
An online therapist pretty soon.
That's right. I mean, why not? If anything, frankly, and as far as I'm concerned, these psychotherapists, they could have multiple patients. They could tell them all the same story and the different stories, and all they have to do every 10 minutes say, how do you feel about that? And that'll they could be having several cell phones going. It becomes a multiple stream.
Yeah.
But terrific. So I think that's pretty much it. But talking about education again as a whole, I back in 1999, I think I wrote a letter to the Department of Education talking about the potential for the government to kind of come in and create an educational curriculum from K to 12 that is idealized, so that that is kind of a 4 or 5 hour a day curriculum, with half hour finding the best teachers in the country that teach those subjects, and create these half hour educational videos, and then make that, and then along with nationalized exams, make that kind of public and free to everyone. And then this way you would address the issue of public education disparities that you find in some of the higher paying tax places and other places. And then it also allows, if it's 20 minutes, it would allow some teachers to have instructions in classroom as well. So, the teachers union would be happy as well. And it would address everything at once. Of course, I didn't get a call back from
They didn't jump on that.
No, they didn't jump on it. Let's put it this way.
Yeah. But
So
I
it
know,
looks like,
so online learning is great, and I would think as we have some topics coming up with for our students on different tracks of either we're doing classic lit review or we're doing still some textbook review for first years, trying to find other resources to supplement that while they have more time in it because they're not coming into the clinic hardly anymore. So, I don't know, the AAE Live Learning Center, maybe they could open that up to be free during this time. I know Adam Azim's platform
yeah.
has some videos on there. And of course, you have a good backlog of stuff that we could hopefully access and supplement our learning
Yeah.
during this time.
No, absolutely. I mean, Rewildendo, we canceled a good 15 or so all-day training courses over the next few weeks, just to be on the safe side again for congregation avoidance and things like that. So overall, and by the way, I think the picture is kind of frozen because of the thing, but it's not a problem. We can hear you. Overall, I think the situation is fluid. It's going to get updated. Hopefully, we can do additional live streams regarding the subject. And I just want to thank you so much for joining me. And I know you're busy, and on a Sunday, I'm sure you probably are want to go and spend time with the family. Thank you so much for putting the time and sharing some of your views with our viewers.
My pleasure.
They all appreciate it.
Thank you, and bye, everyone.
Bye-bye. Thank you. Bye-bye. Alrighty, folks. So that was Dr. Jennifer Gibbs of Howard School of Dental Medicine postdoctoral endodontic program. And I think this is a kind of, as you saw, was a fairly informal understanding backup. I put everything together last night. I hadn't even gone through the presentation once. That's why probably I was a lot more stuttery this time than you normally see me in the videos. But I hope it was helpful and useful to you. I've been looking for questions in the last couple of minutes here that are left for our presentations. So if anybody has any specific questions, just write it down, see what we can do here. Again, morning office, following respected doctors. So I think to summarize everything that we talked about, this virus is clearly a threat. It's a pandemic that is going on currently in many different parts of the world, and the rate of its transmission and severity of the sustained community transmission is different in different parts of the world. What's very important is for each one of you as dentists and endodontists to contact your own local centers and find out how you can best proceed in this situation. As I mentioned, it's important to have a contingency plan at the office that you discuss on a regular basis with your office manager and your assistants, your hygienist, and be sure to just apply the universal precautions above and beyond with the surfaces. Communicate clearly with your patients before they come in about your intention of making sure that they are safe and doing the best of keeping everything clean and being very vigilant about the spread of this disease. Be sure that you ask them ahead of time by your office front desk, being trained in questioning about their health status at the present time. If anyone is having a fever, is having any discharges, sneezing, coughing, or malaise, to make sure that they do cancel the appointment and postpone it for a couple of weeks. There is no urgency in dentistry and dental, and you don't want to expose yourself, your staff, and potentially your other patients to this to this virus and this outbreak. And again, once it comes down to the patients being at your office, do get the vitals, including the temperature. If somebody has a temperature immediately, make sure you discharge them and have them again come back in 2 weeks. But before you do any of that, right at the front desk, when they check in, in my office, we have our patients go brush and floss and rinse, then wash their face first, and then their hands for a good minute with soap and water. you don't really need to have people use so much of these Purell and different types of disinfectants. As I mentioned to you, gave you MacGyvered my own little trick of using finger cots, or you could use a glove. Have a clean hand and a dirty hand. Remember the red saliva videotape that we all watched as dental students, which was kind of showing you the spread of saliva if it was painted red throughout the dental office. That is a key point to keep that in mind. Any surfaces that you touch have to be constantly disinfected with, as we know now, the virus, the coronavirus responds very well to bleach, to about 60% ethanol or alcohol, and also to a low concentration of hydrogen peroxide. And hydrogen peroxide is an easily obtainable type of a solution that is not quite caustic and so on, although be careful because it can cause some rusting in some surfaces and so on. So that's the summary, but we are practitioners. We need to see patients that are in emergency. That's what we signed up for as dentists, as healthcare practitioners. You can't just have a panic attack and close up shop indefinitely until there's a virus. That could take a year or two, as we kind of mentioned. We have an obligation and a duty to our patients, and we need to kind of live up to it. We went to this profession knowing that we're in a healthcare business and we need to care for our patients. Now, at the same time, we don't want to be stupid and help be a vector for the transmission of this disease. But as I mentioned, based on the current information that we have, given the types of spread of the disease and the fact that asymptomatic patients have a very low risk of transmission, as long as you screen people before they come into your doors and take proper precautions with face shields and masks, and as we were talking with Dr. Gibbs, perhaps even a hairnet would be helpful, and full clothing that you need to dispose after each patient, we should really mitigate the risk. If this pandemic is here to stay, chances are that we're going to come in contact with patients, if not patients, with people that have it. So it's our duty as healthcare providers to be sure that we do above and beyond what is required to both keep the health and safety of our loved ones, our staff, and our patients, and everyone in the community to the utmost of possibility. So I'm just going to take a quick last look here at questions, see if there are any other questions. And any dentist who's obviously not feeling comfortable being a part of the treatment and care kind of units can certainly, if they have the capability, they can certainly not see patients. The question here is that we all have to come to this moment of reckoning. If it's going to take months before a vaccine is available, the virus is around and we need to be able to deal with it. The reality is that it is a cold virus, except that in some people, it does cause some complications. And as I said, what we know right now is that the rate is somewhere limited to about 13 to 14%. The highest estimates are around 20%. But 80% of the population that catches this just feels like they had a mild cold and it goes away. We don't know yet specifically the archetype of person who's not an elderly who catches it and could be having a severe manifestation. Men appear to be a little bit at a higher risk than women on this particular virus. And that's pretty much it. Someone's recommending to rinse with 1% hydrogen peroxide. That's certainly a possibility to have patients rinse with that 1% hydrogen peroxide prior to, after, brushing and flossing and rinsing with hydrogen peroxide before your treatment would help. Again, the rubber dam, isolation, all of those things are helpful. And but most importantly, remember, as President Roosevelt said, is that the only thing we have to fear is fear itself. And that is what I'm hoping to get across here, is that there is a small threat out there of a virus that can, in some people, cause severe complications. But majority of people are going to be fine and safe based on the stats that I showed you in terms of the number of people that have recovered and moved on. So the fear of the corona should not turn into hysteria. We should all still try to go on with our daily lives and do our best of achieving the best care for our patients. So Florina says asymptomatic transmission is an issue. Please do not underestimate it. No, certainly I hope I have not underestimated asymptomatic transmission, which is essentially the basis of a community transmission. What I'm trying to say is that our basic methods of universal precautions should be adequate. And here, if we ramp it up from universal precautions to even do better care between patients, cleaning up, maybe you can spread your patients with, having a longer cleaning time for your assistants, and don't jam people in. I'm sure that's not going to be a problem, as many people are going to have to cancel just based on their own fear and hysteria. But what you could do is you can make your appointments a little bit wider apart. This way you can have less congregation in the waiting room, as well as more cleaning time for your assistant to clean surfaces and so on. And that's the main thing. We are not underestimating asymptomatic transmission. What we're trying to say is that the risk of acquiring and transmitting or acquiring the disease from an asymptomatic patient in a dental setting at the present time has known, who's by a practitioner who's applying and using very high level of universal precautions, is not yet shown to be an issue. If it is, and if it changes, I'm sure the ADA through the website that I shared with you is going to communicate that, and I would invalidate everything I'm saying right now. But we have to go based on what we know and extrapolate from there. We can't all freeze in fear until a vaccine is around, because most people out there cannot just close up shop for a year or two and sit around the sidelines, especially if you're the practice owner and you have overhead that you have to deal with. Alrighty, folks, I wanted to thank you all for joining me today on this little impromptu type of a presentation on the COVID-19, the coronavirus pandemic that is going on. I hope this was helpful to you. Leave some comments below and let me know if you think this was helpful. And thanks also to Dr. Jennifer Gibbs from Harvard School of Dental Medicine, postdoctoral endodontics program, for coming in and sharing her expertise and opinions with us. Keep track of the CDC.org, World Health Organization, and the American Dental Association as your resources. Don't watch too much news. News is out there to get clickbait and to scare you. You are all, as dentists and healthcare providers, you're adequately informed and adequately trained to interpret raw data. One of the biggest problems we face in this world is the filtering of information through the so-called experts that are then refiltered again through the media, who's only interested in getting additional clickbait and watch time on their screens. So while I'm not underplaying the importance of this disease and this pandemic, I want to also make sure that people have a safe and a rational level of fear and panic vis-a-vis this disease, rather than an outright realization of some kind of a science fiction Andromeda strain kind of a future that is awaiting us. All right, guys, thank you so much. Love you all. Stay safe and strong and take care of your patients. And I hope to see you very soon again, maybe in another live broadcast, or actually speaking of that, I have a live broadcast on Friday, but that's a different thing. I'm doing that for the courses that we have had to cancel, and that's a different thing. That's by invitation. But anyway, take care of yourselves and stay healthy.